Hi everyone, I am Dr. Divya Shanthi and welcome to NEET PG Core Revision series. These series are focused, structured and exam oriented so that you can recall faster and more confidently in your exams. And in today's session, we are going to break down the anatomy of hamstring muscles as well as the popliteal fossa into clear, high-yielding, exam-oriented concepts. So let's get started. So when we say the back of the thigh, so the back of the thigh or the posterior compartment of the thigh, or otherwise called the flexor compartment. Okay, so the back of the thigh is the flexor compartment or the posterior compartment of the thigh. It extends from the inferior gluteal fold up to the back of the, so from the inferior gluteal fold up to the back. So from here to here is our posterior compartment of the thigh. So this posterior compartment of thigh mainly consists of the hamstring muscles. So posterior compartment of the thigh extends from inferior gluteal fold up to the back of the knee joint. So this compartment is also otherwise called as the flexor compartment of the thigh, because the main flexors here are the hamstring muscles. So we have the hamstrings in here. So the hamstring muscles. Then along with that we have the short head of biceps, which forms a part of the flexor compartment, but it is not a hamstring. And we have a very important nerve, that is the sciatic nerve and the profunda femoris artery. So our main focus will be on the hamstrings and sciatic nerve. So let's see the hamstrings. Now these muscles, the hamstring muscles, we have four. There are four hamstrings and they are the semitendinosus, then we have the semimembranosus, then we have the adductor, the hamstring part of adductor magnus, and we have the long head of biceps femoris. So these are the four hamstring muscles. Now why do we call them as hamstrings? Hamstrings basically comes from the Latin word meaning ham. So these butchers, they used to hang the animals, the thigh part of the animals, by the tendons of these muscles. That's why it's called as the hamstrings. The ham is nothing but the thigh part of the muscles of animals, and which is hung by the tendons of these muscles. So that is why it is called as the hamstrings. Now to say it's an hamstring muscle, it needs to obey four rules. Okay. So what are those four rules? So we have this ischial tuberosity, like a comma shaped ischial tuberosity. So this ischial tuberosity, we divide it into two parts. So we have like this, okay, with an oblique line, we will divide it into a superolateral and an infero-medial part, and the lower triangular part we divide by a vertical line into a medial and a lateral part. So all these hamstring muscles should have the origin from the ischial tuberosity. That is the first point. So the origin should be from where? The ischial tuberosity should give the origin. And the second rule is the insertion should be into one of the leg bones here, okay, one of the leg bones. So it should be either to the tibia or the fibula. And the third thing is they should be supplied by the tibial component, mind you, tibial component, not tibial nerve, the tibial component of sciatic nerve, okay, tibial component of sciatic nerve. And the fourth thing is they are all flexors of the knee and extensors of the hip joint. Okay, so they are by action, they are flexors of the knee and extensors of hip. So that should be the action. So when it follows all the four rules, we call them as true hamstrings. So we have if you see the semimembranosus and semitendinosus, we call them as true hamstrings, whereas adductor magnus and long head of biceps, we call them as false, or we call them as modified. Okay, so semitendinosus and semimembranosus, true hamstrings, whereas the adductor magnus and long head of biceps, femoris, we call them as the false or modified hamstrings. So now we will see why. Now first coming to the origin here. So in the superolateral, the semimembranosus has the origin, whereas in the infero-medial part here we have the semitendinosus as well as the long head of biceps. And here in the lateral part, here we will have the ischial head or the hamstring part of adductor magnus. Medially here basically there is fat. Okay, so thus all these four, they have the origin from the ischial tuberosity. So first rule, all the four muscles obey. Now insertion. Okay, so insertion is into one of the leg bones. So we will look at one by one all the muscles. Now the semimembranosus. So semimembranosus comes from the superolateral part of the ischial tuberosity and it gets inserted, okay, into the groove. Okay, here it gets inserted into the groove on the medial condyle of the tibia. Posterior aspect of medial condyle of tibia, we have the insertion of semimembranosus. Okay, so it is into the tibia. So semimembranosus obeys the second rule too, that is, and it is applied by the tibial component of sciatic nerve, and so obeys the third rule, and it is the flexors of the knee and extensor of the hip. So that is why this is a true hamstring. Next coming to semitendinosus. So semitendinosus along with the biceps femoris, they have the origin from where? From the infero-medial part of the ischial tuberosity. In the upper quadrilateral infero-medial part, they have the origin. So semitendinosus gets inserted, okay, inserted on the upper part of the medial surface, okay, medial surface of the tibia. So it has the origin there. So it gets the insertion into the tibia. Which one? The semitendinosus. And semitendinosus is again supplied by the tibial component of sciatic nerve, and it is the flexor of the knee and extensor of the hip. So it also obeys all the four rules, and so it is also a true hamstring. Now biceps femoris. So biceps femoris has the origin similar to the semitendinosus from the infero-medial part of the upper part of the ischial tuberosity, upper quadrilateral part of ischial tuberosity, and it gets inserted here to the fibula. Okay, so biceps femoris has the insertion. So basically along with the short head of biceps, okay, so short head of biceps, they join to form a common tendon which gets inserted to the head of the fibula. Okay, head of the fibula in front of the styloid process there. So it obeys the second rule too, and the third rule, it is supplied by the tibial component of sciatic nerve. Okay, whereas the short head here, where this is the short head, it is not supplied by the tibial component This is the short head of biceps. Okay, we will come to that. So let's finish with the long head. So the long head is supplied by the tibial component of sciatic nerve, and action is same. It brings about the flexion of the knee and extension of the hip. Then why is it not a hamstring? True hamstring. Why it is not a true hamstring? It is a modified or a false hamstring. That is because morphologically we consider, morphologically we consider the sacrotuberous ligament. Okay, this sacrotuberous ligament as the original origin of the biceps muscle. Okay, so biceps femoris muscle. So original origin goes back to the sacrum. So since it is originating from the sacrum there, we consider it as a modified hamstring. So evolutionary wise, as man became from quadruped to biped, it changed, the position shifted to the ischial tuberosity. So that is why the long head of biceps is not a true hamstring, because sacrotuberous ligament is considered as the original origin of the biceps femoris muscle, long head. Short head of biceps is not a hamstring here. It is not included under hamstrings because the origin, if you see, it is coming from this linea aspera here on the posterior aspect. So it is not coming from the ischial tuberosity, though it is getting inserted to the one of the leg bones. And second thing is, it is supplied by the common peroneal component of the tibial nerve. Next, let's see the adductor magnus. So the adductor magnus here will have two parts. Okay, it has the adductor part, it has the hamstring part. So the hamstring part, we learned that it is having the origin from where? The hamstring part will have the origin from the lower, that is from the triangular part of the ischial tuberosity. From the lateral aspect, it will have the origin okay. So when we take the ischial tuberosity, so this portion, it will have the origin. So origin is here. Insertion, now if you see, insertion, it is into the adductor tubercle. Okay, so it gets inserted to the adductor tubercle, which is present on the medial condyle of the, just above the medial condyle of the femur. So that is why it is not the true hamstring. Then why is it included under hamstring? Because the tibial collateral, morphologically, the tibial collateral ligament, it's considered to be the degenerated part of the adductor magnus muscle. Okay, so that is why, and this tibial collateral ligament is attached to the tibia below. So that is why it is considered as a modified hamstring. And the nerve supply is the same. So it is basically the flexor of the knee joint. Okay, it brings about flexion of the knee joint and extension. It is a weak extensor of the hip joint and supplied by the tibial component of sciatic nerve. Next, coming to the sciatic nerve. So sciatic nerve, as we all know, it is the thickest nerve in our body. Okay, so the thickest nerve is the sciatic nerve. So it is about 1.5 to 2 centimeter wide. Okay, especially in the beginning, it is about 2 centimeter wide. So it arises from the sacral plexus, okay, and it consists of two parts, the tibial part and the common peroneal part. So the root value of this is L4, L5, S1, S2, S3. So it is the ventral divisions, okay, it is formed by the ventral divisions of anterior primary rami of L4, L5, S1, S2 and S3. So in the gluteal region, it comes, okay, in the gluteal region, it arises below the piriformis, so enters the piriformis. Sometimes what happens, we can also see some variation. So usually it is below the, this is the piriformis muscle, okay, so below the piriformis, which is the key muscle in the gluteal region, it emerges. So this is the commonest we see, okay. Whereas sometimes it can be like, the two components can split, the tibial and one of the component can come above, the tibial can come above the piriformis and one below the piriformis. So it can also be that way. So the tibial component, basically the root value will be L4 to S3, and the common peroneal component will be L4 to S2. In the posterior aspect of the thigh, posterior compartment of the thigh, it emerges below the gluteus maximus here, below the gluteus maximus, and it runs vertically downwards. And at the superior angle of the popliteal fossa here, it will divide into two components, that is the tibial. So this is the tibial and this is the common peroneal. Common peroneal nerve and the tibial nerve. So you can see the tibial nerve supplying all the four hamstrings, okay, whereas the common peroneal nerve, it supplies the short head of biceps. So next, in this back of thigh, an important thing which you have to know is about the anastomosis. Okay, so there are two anastomosis which occurs here. One is known as the trochanteric anastomosis, another one is the cruciate anastomosis. So you can see here two sides, the trochanteric and the cruciate. So now here we will see, this is the trochanteric anastomosis. Okay, so we have the trochanteric anastomosis. First we will look at that. So now this is the common, okay, so common iliac artery. Okay, so this is the common iliac artery which will divide into external iliac and the internal iliac. This is the internal iliac. So let's understand the branches first here. Then it gives, this is the superior gluteal and this is the inferior gluteal, okay, from the internal iliac. And here this is the femoral artery, okay, this will be the femoral. Femoral artery will give here one of its largest branch, this is the profunda femoris. It is the largest branch of the femoral artery, profunda femoris. So these profunda femoris now will give, so this is this artery here will be the lateral circumflex and this one is the medial circumflex, okay. And here we have all the perforating, these are all the perforating branches, okay, these are all perforating branches. Now this trochanteric anastomosis, when we see, it is formed, okay, it is formed by the branches. So here you can see from above, we can see the descending branch of superior gluteal, the descending branch of inferior gluteal, the ascending branch of lateral circumflex and the ascending branch of medial circumflex. So these four, they form the trochanteric anastomosis. Whereas the cruciate anastomosis, okay, so the cruciate anastomosis, so this trochanteric anastomosis, it is at the trochanteric fossa. This is located at the trochanteric anastomosis is at the trochanteric fossa. Okay, so this one, that is the cruciate anastomosis. So cruciate anastomosis, we see it at the level of the lesser trochanter, okay. That is at the back of the femur, the level of lesser trochanter, we see the cruciate anastomosis. So here, which are the branches we can see now? We have the descending branch. From above, we are seeing the descending branch of inferior gluteal. Then we are seeing the transverse branch. So this is the transverse branch of, okay, this is the transverse branch of lateral circumflex. Then we have the transverse branch of medial circumflex. So this is the transverse branch of medial circumflex, okay. So lateral circumflex and medial circumflex. here, and one is, this is the ascending. So this branch, we have the ascending branch of first perforating artery. Okay, so these vessels, they form the anastomosis in the back of the thigh. So now let's study the popliteal fossa. Now what is popliteal fossa? Popliteal fossa is similar to our cuboidal fossa, but here it is the diamond shaped. Okay, it's a diamond shaped hollow which we see on the back of the knee joint. So why this popliteal fossa is important? So you can see this is the popliteal fossa. It's a diamond shaped hollow which we see on the back of the knee joint. And why is this important is because many vessels and nerves, okay, they pass from the thigh to the leg region through this fossa. So that is why we need to understand the anatomy of the popliteal fossa. This is the popliteal fossa. So since it is a diamond shaped, it will have 4 boundaries. So it's a diamond shaped fossa, so it will have 4 boundaries. Okay, so here if we see now, okay, so this is the lateral, this is medial. Okay, so anterior, posterior, superior or inferior we can say. So medial, lateral. So it will have superior-medially. Okay, so superior-medially here, so on the medial aspect, it is formed by semimembranosus, okay, as well as the semitendinosus. So these 2 muscles, they form the superior-medial boundary, whereas superior-laterally it is the biceps femoris. Biceps femoris forms the superior-lateral boundary. Okay, and here inferior-medially we have the medial head of gastrocnemius, muscle. Okay, so this is inferior-medial boundary, and inferior-laterally we have the lateral head, and supplemented by this is the lateral head of gastrocnemius, which is supplemented by the plantaris. Okay, plantaris. These 2 form the inferior-lateral boundaries. So these are the boundaries of the popliteal fossa. So here the floor. Okay, so first let's finish the roof. Okay, so the roof is also called the posterior wall. Okay, so it is formed by the strong popliteal fascia, which is nothing but the deep fascia in that region. We call it as the popliteal fascia there, and the superficial fascia. And in the superficial fascia we will see 3 cutaneous nerves. One is the terminal part of this is the terminal part of posterior cutaneous nerve of thigh, posterior cutaneous nerve of thigh. Then we have the posterior division of medial cutaneous nerve of thigh. Okay, medial cutaneous nerve of thigh. And then we have the sural communicating nerve. Okay, this is the sural communicating nerve. And here we see the short saphenous vein which will enter the fossa by piercing the short saphenous vein. Okay, so these structures we see in the posterior wall, or otherwise called the roof of the popliteal fossa. Next, coming to the floor. Okay, so the floor of the popliteal fossa, here if we see, here in the upper part we have the, from above downwards, if we see, this is the popliteal popliteal surface of femur. Okay, so the same thing we can see here, which is covered by fat here. So the popliteal pad of fat we can see there. Then we see the capsule. Okay, so here all around here the capsule of the knee joint. Capsule of knee joint. Okay, so here you can see, so this is the capsule of the knee joint, and then we have the oblique popliteal ligament. This is the oblique popliteal ligament, and this is the fascia covering the popliteus muscle. Okay, this is fascia covering the popliteus, so we can see it here. So these structures from here to here will be forming the floor of the popliteal fossa. Next, coming to the contents. Okay, so the contents of the popliteal fossa here mainly are the popliteal artery. So we have the popliteal artery here and its branches, popliteal artery and its branches. Then we have the popliteal vein, the popliteal vein. This is the tibial nerve. Okay, tibial nerve will be running vertically downwards. Then here on the superolateral aspect we will see the common peroneal nerve. Then we have the popliteal lymph nodes. And the popliteal pad of fat. So these are the main popliteal pad of fat. Okay, so these are the main contents of the popliteal fossa. In addition to that, also the roof contents, which we saw, the three cutaneous nerves and the short saphenous vein, are also considered. So the arrangement of these structures, especially the three main, the popliteal artery, popliteal vein and tibial nerve, is important in the popliteal fossa. So in the upper part, okay, from lateral to medial. So this side is lateral, that side is medial. Okay, so lateral to medial, when we see, it is the artery, vein and nerve. Okay, that is which artery? Popliteal artery, popliteal vein and tibial nerve. In the middle, from superior to deep, if we go, it is nerve, vein, artery. Or you can also say from anterior to posterior, artery, vein and nerve. Okay, that is anterior in anatomical position when we take. In the lower part, okay, from lateral to medial, it will be the other way round, that is nerve, vein and artery. So this is the arrangement in the popliteal, in the upper part, middle and in the lower part of the three main structures. So let's see some of the important branch of popliteal artery here. So popliteal artery is nothing but the continuation of the femoral artery, which enters the popliteal fossa through the adductor canal. So once it is in the popliteal fossa, it will give, okay, mainly three groups of branches. One is the cutaneous branches, muscular branches and the articular branches, which we also called as the genicular branches. Because the knee, see, genu means kind of bent, okay, when we bend the knee, right, for the flexion. So that is why around that, those branches we call them as the genicular. So cutaneous branches, basically they pierce the roof and supply the overlying skin. The muscular branches are very large, okay, and the muscular branches will be supplying mainly the adductor magnus. So muscular branches will supply the adductor, magnus and hamstring muscles. They are the hamstring muscles, okay, the upper part. And in the lower part, they will also supply the two head of the medial and lateral head of gastrocnemius muscle, as well as the soleus and plantaris. Okay. So these three muscles together we call them as the triceps 𝗠𝗓 muscle. The two heads of gastrocnemius, the soleus and the soleus, together we call them as the triceps 𝗠𝗓. So these muscles are supplied by the popliteal artery. The genicular, we have 5. So here in the upper part we will see the superior medial. So this is the superior medial, and the superior lateral genicular. They take part in the anastomosis there around the knee joint, superior lateral. Then infero-medial and infero-lateral. Infero-medial here and infero-lateral genicular. Infero-lateral genicular. And here we have the middle genicular branch. Then it divides into 2 here. Okay, so this is the anterior tibial and the posterior tibial. From posterior, here we will also have the peroneal. Okay, so these are the branches. So peroneal is basically from the posterior tibial. So these are the branches which are given by the popliteal artery in the popliteal fossa. Then the tibial nerve. Tibial nerve is the main nerve, okay, largest terminal branch of the sciatic nerve. So this tibial nerve in the popliteal fossa will be running vertically downwards. So this tibial nerve also gives the cutaneous, the articular branches, and the, that is we call it as genicular branches, okay, and to the muscles it supplies, as well as the vascular branches. So the muscular branches mainly supplies about the heads of the gastrocnemius, the soleus, plantaris and popliteus muscle, whereas the genicular branches, okay, so the genicular branches, if you see, so this is the tibial nerve, okay, so it has the origin where at the superior angle of the popliteal fossa, the root value is L4 to S3. Okay, so the tibial nerve, it extends vertically downwards from the superior angle of the popliteal fossa, crosses the popliteal artery in the middle part, right, and then it goes down into the posterior compartment of the leg. So it mainly gives the, as I said already, the muscular branches, the cutaneous branches, the genicular branches, as well as the vascular branches, okay, vascular branches. So it gives these branches. So muscular branches, I told you, they supply the gastrocnemius, plantaris, soleus muscle, popliteus muscle. The cutaneous branch is also called the sural nerve, okay. It is the sural nerve. The genicular branches, there are 3. So we will see it here. So here you can see it is supplying all the muscles. This is the plantaris muscle, plantaris, then lateral head of gastrocnemius. This is the soleus as well as popliteus, then medial head of gastrocnemius. Here we have the genicular branches. This is the superior medial genicular, superior medial genicular branch, inferior medial genicular branch, and this is the middle genicular. So these are the 3 genicular branches it gives. So these are mainly the branches in the popliteal fossa. Vascular branches, they supply the popliteal vessels. So let's look at some of the MCQs. So image shows a diamond-shaped depression behind the knee. A structure is marked centrally and deepest. What is it? Okay, centrally and deepest will be the posterior aspect, deepest will be the popliteal artery. So it is the right choice. Image shows a nerve winding around the fibular neck. What deficit is expected when it is injured? So, around the fibular neck. So, we saw that in the popliteal fossa, tibial nerve will be running vertically downwards, whereas the common peroneal nerve will go laterally, right? So, that will wind around before it divides into its two divisions, superficial and deep, it winds around the fibular neck. So, usually when it is injured, it causes loss of dorsiflexion. Then image shows a structure passing through the adductor hiatus into the popliteal fossa. So, passing from through the adductor hiatus, that is from the thigh region into the popliteal fossa. So, that will be the femoral artery. Whereas the popliteal vein from the popliteal fossa, it passes through the adductor canal and continues as the femoral vein. Okay. So, it will enter the thigh. The image shows a muscle forming inferolateral boundary, okay, inferolateral boundary of popliteal fossa. So, which one is the inferolateral? Is this side here now. So, how will we see? We can see the semimembranosus. Semimembranosus will have a very membranous origin and go. Semitendinosus will have a tendinous insertion here. So, here you can see the biceps and the short head here joining to form a common one. They are not separate tendons, so you do not see two muscles here. So, this side will be the medial aspect, this is the lateral here. So, laterally we have the lateral head of gastrocnemius. So, A is the right answer. Image shows swelling in the popliteal fossa that increases on knee extension. Okay, so, swelling in the popliteal fossa. So, that is the Baker's cyst. So, Baker's cyst is basically the inflammation there, okay, of the bursa, which we call it as the Baker's cyst. Image shows a nerve lying superficial and midline in the popliteal fossa. Nerve which lies superficial and midline. Which is the nerve? It is the tibial nerve. So, B is the right choice. Image shows hamstring muscle inserting on the medial surface of the tibia, pes anserinus, that is the medial surface. Which one is that? On the medial surface, we have the semitendinosus. Semimembranosus, it gets inserted into the fossa, that is behind the medial condyle of the tibia, it gets inserted. Biceps femoris with the head of the fibula. So, and sartorius is not an hamstring. So, the right answer will be semitendinosus. Image shows a structure piercing the deep fascia and draining into the popliteal vein. So, which vein is that? The short saphenous vein or the small saphenous vein. Image shows posterior thigh muscle originating from linea aspera. So, which muscle originates from linea aspera? Because rest are all hamstrings in the posterior. So, it is only the short head of biceps. So, we have the D is the right choice. So, that is the end of the hamstring as well as the popliteal fossa. So, be consistent with the series. I will see you in the next session.